Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Noemi Adame. She's a pediatrician. Today's Kevin MD article is Having a Female Doctor is Better for Your Health, but Not for Hers. Noemi, welcome to the show.
Oh, I'm so excited to be here, Kevin. Thank you.
All right, so let's start by briefly sharing your story and then talk about what led you to write your Kevin MD article.
Sure. So, as you said, my name is Dr. Noemi Adame. I'm also known as the Veggies Over Pills Doctor. I'm a board certified pediatrician, whole foods plant based home cook and baker. I'm a writer, I'm a
Mhm.
speaker. I have over 20 years of experience in medicine. I am the founder of Culver Pediatric Center. It's a concierge style direct primary care practice where we take a holistic approach to the care of the child. And beyond the exam room, I'm passionate about advancing the direct primary care movement, but in a way that is sustainable and burnout proof,
Mhm.
especially for my female physician colleagues.
All right, so we talk a lot about, of course, burnout and burnout among female physicians. So tell us more about your Kevin MD articles titled Having a Female Doctor is Better for Your Health, but Not for Hers.
Right. So I am going to start out by saying that I respect and appreciate all of my male physician colleagues. So just bear with me, gents, for a bit. If anyone listening has not read the article, please read it. Basically, in a nutshell, I go over how there's good evidence that female doctors demonstrate better outcomes across multiple fields of medicine with patients, but they experience higher burnout
Mhm.
rates than our male colleagues. And I communicate best through writing. And this article has been percolating in my heart and my mind for years. I remember as a young hospitalist noticing the different interactions that patients and staff had with female physicians compared to male. I remember working in clinic when I was still employed in corporate medicine, watching as my male colleagues left at 5 or 5:30, and while I was still there, sometimes hours later. And of course, imposter syndrome takes over, right? And so I thought it was me. I am not good enough. I am less efficient, to the point where I actually asked for a time flow study from my employer at the time.
Mhm.
And the person who watched me was and conducted the time flow study was an EHR super user. And she found that I was actually very efficient with my time. I would come in early on my clinic days to prep. So by the time that I walked into the exam room, the visit was very streamlined. I huddled with my MA before clinic to make sure that we had everything prepared
Mhm.
and we weren't wasting any time, that there was no like lag time. She commented on my typing, that I typed very fast and that my notes were very thorough, that a scribe would actually be a downgrade and not helpful. So fast forward to me leaving corporate medicine, starting my own DPC practice, I also realized very quickly that in that space also there's issues and concerns that affect female DPC docs disproportionately. And it makes sense. As I mentioned in the article, portal data shows that both patients and staff make 25% more requests of female primary care
Mhm.
doctors than male, which of course explains the longer work days and the
Mhm.
EMR time, the added EMR time that is uncompensated and unrewarded time. So, with this information and other issues like the second shift at home, it's not surprising that the studies show that female doctors have higher burnout rates. So, what made me write this article? I think the sentinel event for me was really started 2 years ago, when my mother died
Mhm.
suddenly and unexpectedly. I did not feel I could disconnect from work. I owned the practice, I was the boss, and I showed no compassion to myself. I look back and realize that there's so much I could have done to disconnect and be present in that very important moment, very important week. But I think this was me responding to years of socialization of women must put the needs of others
Mhm.
first, which is exponentially magnified with women in medicine. I literally sat in the ICU watching her die
Mhm.
while I responded to texts
Mhm.
and sent refills to the pharmacy. And in the aftermath of processing all that trauma, I reevaluated my entire life. I restructured a lot of my workflow and my processes. I hired staff to help me. I outsourced social media to my daughter. So she's our favorite Nepo baby here. And it took me a long time to, after that experience, not only to articulate those thoughts and feelings into words, and I wanted to embed a lighthearted twist on a
Mhm.
very heavy topic. And I hope that came across in the article.
Sure.
But I also wanted to have a solution and an action plan to go along with it. I wanted to not just put these thoughts on paper, but I didn't want to just bum everybody out with this concerning data. I
Yeah.
wanted to offer a solution. I'm the firstborn daughter of immigrants, right? So problem solving laced with external validation, that's my my drug of choice. So the final push that I needed to write this was two things. A first was an article published in JAMA less than 2 months ago that essentially showed that while generally women outlive men, that's not the case amongst physicians. We don't
Mm.
have that longevity benefit. And there's a lot of reasons that are explored in the article, but the added stress specifically of being a female doctor may contribute to that lack of longevity benefit. And the other was I attended the pediatric DPC mastermind around the time that the study was published. And I mentioned to one of my colleagues, Dr. Deanna Berry, who coordinates the mastermind, that I did some retreats for some parents that were very helpful. And she sidebarred me and said, you need to do retreats for us. So with that, I felt like I could put pen to paper, not just with the data about what's going on with the burnout rates in amongst female physicians and my own thoughts about it, but with a solution in the form of a physician women's retreat, which is scheduled for September 4th through 7th.
All right. So before we talk about some of these solutions, you
Yeah.
mentioned, of course, you work in a corporate setting. So
Mhm.
can you envision any type of corporate setting, acknowledging the data that female physicians spend more time in the inboxes and spend longer times interacting with patients and making any type of amends to kind of compensate for that? Do you see any of that happening?
And of course I'm going to answer that, and I'm going to preface it with a bias, right? I'm a DPC doctor, and DPC doctors, we are DPC evangelists. And a lot of us, certainly in my case, we have been quite morally injured by the corporate medicine world. So for me, it is very difficult to envision a situation, to envision the corporate medical system basically saying, oh yes, female doctors, we're going to give you more time with patients, we're going to use other metrics besides volume to determine quality and to compensate you. I have a really hard time seeing that happen, which is why I mentioned in my article, my recommendation is to leave.
Hmm.
But if someone can prove me wrong about that, I will take it. And I would be very happy about it. But I just, with the current system the way it is, I just don't see it
Hmm.
happening.
So tell us about moving to direct primary care. And you said even in direct primary care, female physicians in direct primary care are
Yeah.
still burned out and undergo some of that same gender specific stresses. So tell
Right.
us the path forward. What do you think?
Right. So I think a few years after opening up my practice, I realized that I had jumped out of the corporate medicine frying pan into the DPC fire, and it was completely self inflicted. I set very unrealistic expectations for my patients, like responding to texts within minutes when I first started out and didn't have a big panel. And these expectations were just not sustainable as my practice grew. So now, 5 years in, I'm retraining my patients. And thank goodness, 99% of them are so understanding and so grateful. And they want me to be healthy physically and mentally so I can take care of their kids for a long time.
Yeah.
But I do wish that someone had told me at the start, hey, don't respond to text within 5 minutes, set a timer, wait a few
Hmm.
hours, so that when you do get busy down the road and you do take a few hours to respond, your patients are okay with that. They expect that's the standard operating procedure. So those are the kind of pearls that this September retreat will address.
So, are there any systemic changes beyond what female physicians can do individually that you think can help solve this issue?
Well, it boils down to money. It really does. When the one metric that the system uses to compensate physicians, to assign value to a physician is not the quality of care that they deliver, but the volume, like how many patients you can see in one day, it's going to be difficult, right? It's going to be difficult. If we were to move to a system where things like, what are your outcomes,
Hmm.
what is your relationship with your patients. The low hanging fruit, of course, is patient experience surveys, and there's pitfalls that we can talk about for an hour about that. But I think finding some sort of objective way to measure adherence to guidelines, for example, relationship with colleagues in a 360 type of evaluation. If we were to move from this RVU volume, how many patients are you seeing type of system, and more into into quality metrics that actually assess quality and not quantity, I think that we can start moving the needle towards change.
So what other tips do you have for other female physicians who may be listening to you, who may be working in a corporate setting and experiencing what you did however many years back? What other tips do you have for them?
I want my female identifying physician colleagues to continue to deliver amazing care. We need to keep doing that. But I want them to do it without harmful self-sacrifice. So I advise, protect yourselves, set boundaries, and remember, no is a complete sentence.
A lot of people, both male and female, find that difficult because as physicians, right, we jump through a series of hoops. We are by nature people pleasers. So how does one go about setting those boundaries? Give us an example, some tips, because I hear that a lot and I agree with you. I think that physicians in general, we need to set more boundaries. But is there a process or a mindset that you advise clinicians to go about doing that?
Right. So one thing that really helped me is using the acronym FAST. I heard about it in a DPC women's Facebook group, and it has been so helpful for the mindset change. Whenever I feel a boundary is being pushed, then I ask myself, is this fair to both of us? Is it fair for me to provide you with the free medical care that you're asking for just because we have a relationship outside of medicine? Is it fair for me to see your child for a sports physical at 6 p.m. on a Wednesday, the night that I have dinner, the only night that I have dinner with my son and husband together, because that's the only time that you won't miss work, or your child won't miss sports practice? So like, who's going to give more in this relationship? So that's the first thing, a physician that's feeling that pressure, with a boundary, is ask yourself, is this fair to both parties involved? The other is, don't apologize. That's what the A stands for, is don't apologize. And I have worked really hard to not do that. For example, if I am running late to a patient appointment, instead of saying, I'm sorry, I say, thank you for waiting. Thank you for your patience. I really appreciate it. And that creates just a huge mindset change. And it really makes me feel better. And what I hope will also tell the patient, I wasn't running late because I was out having drinks or I was out eating bonbons. There were systemic issues, right? There were issues why I was helping somebody else. So that has also helped, not apologizing. And the other is sticking to your values. That's the S. Don't make exceptions. Don't bend the rules, because the moment you do that, then that person is going to keep pushing the boundaries and is going to keep testing them. And it is really going to cause tension in the relationship. So that's the S. And then the T is tell the truth and don't exaggerate, explain the consequences. For example, in my case, if I have someone who wants me to see them at a time where it's infringing on my personal time, I'm very upfront about it. I said, okay, if I see you at that time, that's a time that I have dinner with my husband and with my son. I can see you at this other time. I won't have to infringe onto personal time. Is there any way you can make that work? And there are times, yes, I will tell my family, I can't have dinner with you because I'm going to, see a patient. That's the life of a doctor. Our families know that, right? Our families are completely used to us missing birthday parties and missing dinners and missing, events because of patient care. But I do at least want to negotiate with the patient, and I do want them to know, hey, this is what I'm giving up. I'm giving up a dinner with my family. So that's where I'm not going to exaggerate, but just be very truthful about what the consequences are with that when we push that boundary.
We're talking to Noemi Adame. She is a pediatrician. Today's Kevin MD article is Having a Female Doctor is Better for Your Health, but Not for Hers. Noemi, let's end with some take-home messages that you want to leave with the Kevin MD audience.
So I want to end by saying that most patients appreciate you. Most patients understand that you're human. Most patients understand that you you have a family, that you eat, that you go on vacation. But sometimes it's us that need to accept that about ourselves, that we are human, that we do have physical needs that we also need to address. And it's just so important as physicians that we stop glamorizing overwork and stress and being super, super busy, that we don't have time for our families. I think that is just so important, because if we are healthy, then we are going to be able to be much better healers for our patients. So yeah, I do encourage, if you're a female identifying physician, to join us for this retreat in September. Just check out our website, www.coverpediatrics.com, and check out at the page under for DPC Women's Retreat. And I look forward for you to join us for a weekend of learning, recharging, and connecting.
Noemi, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
All right. No, thank you.